To my opinion, this was the first meeting for me in Romania again after very many years. And to my opinion, it was a very successful day. I had the opinion that it was very interactive, that the attendees were happy to discuss with us, to share their opinion and to share their thoughts with us. So I had the impression that it was for me at least, it was a successful meeting. For a radiologist, it is important that you have a dedicated question. So as better the question is, the better will be the answer from the radiologist. And if you have a good question, then the radiologist should know which kind of CT he needs to answer this question. And the sort of CT, having a HR CT without contrast median inspiration, actually what was said before also, this is the basis actually for a good radiological diagnosis. And you should you should not make a diagnosis, you should make only a description of the image and come to a conclusion of a decent pattern. And together with the other doctors, with the physician, with the pathologist, you should decide then what the diagnosis for your patient is. I think it's the CT, it's the image, it's the image first of all. Then it's a good anatomical knowledge about the lung and the structures in the lung and where we and where the pathologies are located. And third, software post-processing might be an opportunity in the future, but it is not at the moment. So we are working, several groups are working scientifically on this theme, but at the moment for clinical management, software post-processing is not a matter already. As I said, the appropriate question. So I need an appropriate question. I need to know what problem does the patient have, what does the physician want to know, what shall I answer with my image. And once this is done, then I can give do a CT and give my impression about the CT. And this collaboration between the two, at least between these two specialities, ideally actually between the pathologists also, are crucial because physicians and radiologists have different experience with, are different experts in their field. And that's why they have to come together. So that you sometimes will, if you discuss the case multidisciplinary, you might be in the position to revise initially made diagnosis. And interstitial lung disease is a disease where you have to be where you have to encourage yourself to revise your diagnosis because it's changing. As knowledge, of course, is changing also about the diseases. I think that we are not at the end of the development, and after the new guidelines have been published, I'm very sure that science and scientific evaluation will go on, and maybe in 5 years or in 10 years we will probably have a revision of these guidelines, and hopefully we will be even a little bit more sensitive and more specific. We are very sensitive because our CT is now very good. We can see very tiny changes. If we do a HR CT, we are below the 1 millimeter resolution. So actually this is a very good quality which we have. But On the other side, I think that, as said before, in the past we think that we will have a sort of a potpourri or a puzzle where we can, like in cancer, do sort of a individualized diagnosis, and of course then probably, hopefully, individualized therapy. Our experienced patients benefit from being treated in a center. Of course, not everybody can be treated in a center, and that's why maybe that at the beginning they should be, the diagnosis should be confirmed in the center, but the knowledge about managing and management of the diagnosis must be transferred in the periphery as well. So the knowledge about the diagnosis and the treatment has to be transferred. So we are, even in Germany, we are not in that case that we have a homogeneous knowledge all over the country. But I think people have to be aware of the diseases, they have to be aware of the way they look like by imaging, they have to know how to approach to the diagnosis, and then if you have a suspicion, of course, it's much easier to find the diagnosis. What we thought was important is teaching. You definitely have to do teaching to organize things, workshops like this in the country, and teach people how to approach to these patients and to these diseases.